Procalcitonin guide use of antibiotics for lower respiratory tract infection. Introduction: The overuse of antibiotic agents is a public health problem associated with increased healthcare costs and antibiotic resistance. Overuse of antibiotics is a common infection of the lower respiratory tract, where bacterial and viral infection manifest similar. Procalcitonin is effective with levels that are more typical elevated in bacterial than in viral infections. Video.
Overuse and misuse of antibiotics is one of the world's most pressing health problems, said Dr. Asha Thomas, medical director for Doctor On Call, a 24/7 medical services facility that provides healthcare services at homes and hotels. Economists estimate that without intervention, up to 10 million deaths globally could be attributed to antibiotic resistance by 2050. To combat antibiotic resistance and avoid adverse reactions, patients should use antibiotics appropriately, only as needed, and most importantly, correctly. For more information, please contact Dr. On Call. Brought to you by Atos Wire.
Application in medicine. Procalcitonin is effective with levels that are more typical elevated in bacterial than and viral infection. The magnitude of the elevation correlates with the severity of the infection, and the decreased level over time correlates with the resolution of infection. Video.
My name is Eric Luck. I am the Director of Critical Care Services at Swedish Covenant Hospital in Chicago, Illinois. Bacterial infections are serious life-threatening illnesses. They need to be identified rapidly and accurately. Studies have shown that the earlier that we start appropriate therapy for infectious diseases, the better the outcome. What has been a problem over the last 3 decades has been the lack of sensitivity and specificity of the diagnostic tests that we had available to us. Culture results are often negative, even when the patient is overtly infected. White counts are unreliable. Fever curves are often not interpretable. We have been looking for other means of identifying infections. Procalcitonin has come to our aid. It's highly specific, very sensitive, and available in a timely fashion. It has really changed the landscape for both the identification of patients who are infected and for the identification of patients who are not infected. It is a highly specific response to bacterial infections, inhibited in fact by viral infections, and therefore really aids the clinician both in its kinetics and its specificity in identifying those patients who have bacterial infections and those patients who do not. When there's a bacterial infection, the levels increase. They increase proportionately to the severity of the infection, and therefore gives the clinician information about the presence of a bacterial infection and severity as information as well. From the onset of infection to the release of the procalcitonin is somewhere between 4 and 6 hours. As the stimulation continues, the procalcitonin levels will continue to rise, and they will continue to rise until effective therapy is given to the patient, at which point in time they will stop increasing and typically have a decline of about 50% per day. So the half-life is about 24 hours. There is a delay between the stimulation and the release of about 4 to 6 hours, which gives us a unique property such that when the patient presents, it is more likely that the procalcitonin levels will be elevated than some of the other biomarkers that have been associated with bacterial infections. Many of my colleagues have asked me about, should I invest in procalcitonin?
Pros and cons. Pros. Procalcitonin has the advantage of providing additional information to the clinic examination. It is also useful in the follow-up of the infection process and in the decision to suspend or continue the treatment. Cons. Procalcitonin is a biomarker that also rises in neoplastic disease. For this reason, does not yield good results in this type of patient. Video.
Namaskar, I am Dr. K. Agarwal, Group Editor-in-Chief MedTalks and President Heart Care Foundation of India. To diagnose sepsis, do I rely on ESR, CRP or procalcitonin? CRP and ESR are acute phase reactants. Their presence basically tells us the intensity of an inflammatory process, but they are non-specific to any particular disease. Procalcitonin, on the other hand, may differentiate an inflammatory from a non-inflammatory disease. It may differentiate an infective from a malignant neoplasia. Therefore, procalcitonin may be suggestive of a possible infection or a sepsis. In ESR and CRP, we always look for two values. And a change in APR, that is acute phase reactants, of more than 25% is significant. If it reduces by 25%, then you know it is significant. If it increases by 25%, you know it is significant. Regarding CRP, we always do for, if the CRP is negative, we go for high sensitivity CRP, and if it is less than 0.3, it is normal. If it is more than 1, we know there is some inflammation or infection, and if it is between 0.3 to 1, we know there is a low-grade inflammation. And one of the situations of a low-grade inflammation is a patient with coronary artery disease. And when the value is between 0.3 to 1, we sometimes give statin to reduce low-grade inflammation. Thank you.
Easy applied in Ecuador. In Ecuador, procalcitonin is used as an acute phase reactant. Its indetermination allows the different several bacterial infection for viral infection. Conclusions. The result of the trial of procalcitonin, together with the instruction of the interpretation to the emergency department and to the doctor of the hospital, did not lead to the lower use of the antibiotics than the usual care among patients with suspected lower respiratory tract infections.